The differential diagnosis of seizures and epilepsy. A seizure is a sudden, transient brain activity disturbance, and epilepsy is recurrent, unprovoked seizures that can be less than 2 hours apart or less than 24 hours apart. The seizure phases are preictal, ictal, and postictal. Preictal is anxiety and behavioral changes that last for 1 to 24 hours. The ictal phase is convulsions and tonic-clonal activity, which can last from 10 seconds to 1 hour. And the post-ictal phase is disorientation and blindness, which lasts around less than 2 hours. For diagnosing seizures in epilepsy, we use the vitamin D acronym. Vascular, inflammatory, trauma or toxic, anomaly, metabolic, idiopathic, neoplastic, or degenerative. Vascular can be stroke or hypoxia, inflammatory can be encephalitis or FIV, trauma can be injuries or toxins, anomalies are hydrocephalus or Chiari malformation, and metabolic can be hypoglycemia or uremia, idiopathic can be primary epilepsy, neoplastic is tumours, and degenerative can be age-related changes. For active seizures and status epilepticus, the signs are prolonged convulsions, tonic-clonic activity, and hallucinations. For the treatment, you can give diazepam intravenously or rectally, phenobarbital, the loading doses for persistence, and propofol for refractory cases. For the diagnosing, there can be extracranial causes and intracranial causes. The extracranial causes are metabolic and toxicosis. The metabolic extracranial causes are hypoglycemia, uremia, and hypocalcemia. And for toxicosis, this is organophosphates, ethylene, glycol, and lead. The intracranial causes can be structural or infectious. The structural ones are hydrocephalus, trauma, and tumours, and the infectious ones are encephalitis and meningitis. The paroxysmal events in dogs are narcolepsy or cataplexy, as well as exercise-induced collapse or canine epileptic cramping or Scotty cramp. Narcolepsy and cataplexy are in Dobermans and Labradors, and you treat with amitriptyline or selaginine. Exercise-induced collapse is found in labs, and you can treat with diazepam. And canine epileptic cramping is found in Border Terriers, and you treat with diazepam. And Scotty cramp is found in Scottish Terriers, and you treat with fluoxetine. In feline epilepsy, we have FEPSO, FOPS, FHS, and FARS. FEPSO is feline partial seizure oral facial involvement. This is when the cats have facial twitching. FOPS is feline oral facial pain syndrome. The cats have oral pain and you treat with phenobarbital. FHS is feline hyperesthesia syndrome. This is when cats have skin rolling and you treat with amitriptyline. And FARS is feline audiogenic relaxed seizures. These are sound-triggered seizures and you treat with levetiracetam. For epilepsy management, the goals are to reduce seizure severity, frequency, and duration. The first-line drugs are phenobarbital, which is a GABA agonist, and imepatone, which is a benzodiazepine agonist. You can give potassium bromide for refractory cases, but the adverse effects of these drugs can be sedation, ataxia, polyuria, polydipsia, and paraparesis.